Good afternoon. Our presentation will begin in just a few minutes. Good afternoon and welcome to Bridges at Lakeview Health, our educational series that connects addiction and recovery subjects for our communities across the nation. We want to thank you all for joining us for this special event. Today we will be presenting on becoming a part of change, advocating an end to addiction stigmas. This presentation will serve as a guide to educate addiction treatment and healthcare providers, as well as the general public of addiction stigmas, effects of stigmas, and methods to reduce stigmas at public, structural, and individual levels. For those of you who are unfamiliar with Lakeview Health, we are an adult-only addiction treatment facility located in Jacksonville, Florida. Since 2001, we have been leading the way how addiction is perceived and treated and how recovery is managed. We are a passionate team of difference makers whose mission is to empower profound recovery through exceptional, dynamic, and evidence-based care for individuals and their families. Our commitment is to our patient. This commitment does not end at discharge, but is continued through our aftercare and alumni support. Before we get started, I wanted to share a few housekeeping items. Throughout the presentation, participants will have the ability to submit questions by way of the Q&A box listed in the panel on the right-hand side of your screen. At the end of the presentation, the presenters will answer any questions you may have. Please note that all participants' microphones and video cameras are muted throughout the presentation. Within 24 hours following the event, we will email participants the post-test, course evaluation, and event recording. As a reminder, to receive the Certificate of Completion for Continuing Education credits, you must be in attendance for the entire presentation, complete the evaluation, and pass the post-test with at least a 70%. Our presenters today are Lakeview Health Patient Advocate, Alyssa Brown, and Aftercare and Alumni Supervisor, Lexi Lehan. Alyssa Brown is a patient advocate at Lakeview Health and the creator of the new anti-stigma advocacy program. She's currently a graduate student working to obtain her MSW at the University of North Florida. While studying to obtain her Bachelor of Psychology, she served as a research assistant in the Behavior and Addictions Lab at the University of Southern Mississippi. Ms. Brown found an interest in advocating an end to addiction stigmas through her role as an assistant program director of the Collegiate Recovery Community at USM, where she helped organize a study aimed to reduce stigmas within the community. Lexi Lehan is the Alumni and Aftercare Supervisor for Lakeview. As an alumna of the program, she truly understands what our patients go through while they are here and after they discharge. Originally from a small town in Northwest Pennsylvania, Lexi made the decision to completely change her people, places, and things and come to Jacksonville, Florida to begin her journey in recovery. After completing treatment in January 2015, she went to a local sober living in Jacksonville and started engaging with our True North alumni support groups and events. In 2017, Lakeview Health hired Lexi as the aftercare coordinator at our Rose facility, knowing she would be able to use her personal experience to help other women. Lexi believes Lakeview Health gave her the knowledge and the tools she needed to stay sober. She says she feels honored to pay it forward to patients during their stay with us and afterwards as True North alumni. Thank you for your time. Now over to our presenters.
Hi, so I'm Alyssa. I'm the patient advocate here, and then this is Lexi.
Hi everyone, I'm Lexi Lehan.
So today we're going to be talking about just advocating an end to addiction stigmas that play a large barrier into preventing individuals from seeking treatment. So these are a couple of our objectives that we're going to go over. So first, we'll define public, structural, and self-stigma, understand the harmful effects of stigma on substance use disorders, examine potential biases and assumptions related to addictive behaviors, and learn strategies to reduce the stigma associated with addiction.
So everyone has probably heard that if you're in this field or in this average, the word stigma, you've heard, reduce the stigma, and it's a buzzword, as I like to say. But what does that really mean? What does stigma really mean? That's what Alyssa and I hope to go over with you today. And, what are the realities of, and how do the stigmas impact a person with a substance?
So these are just like a couple of examples of where you might find stigma. So just like between talking with family and friends, somebody might refer to, somebody within their family or friend group as, an alcoholic or something like that, and use some of those negative labels. And then sometimes, within healthcare providers, we'll see some of those labels used and just see kind of negative attitudes towards individuals who have like a diagnosed substance use disorder, especially in treatment, like healthcare provider facilities and stuff, who might not have as much information and knowledge into addiction. And then also just within like employers and coworkers who might, because sometimes like as a patient advocate, I'll notice that people come in to treatment and they're very nervous about what their employer might think, worried about being stereotyped or, discriminated against in the workplace and things like that. So this is just really like a place to kind of help get rid of like all of those negative labels that are associated with substance use disorders. So to define stigma, the Center for Substance Abuse Treatment described 5 important points. So addiction-related stigma is a powerful, shame-based mark of disgrace. Stigma is generated and perpetuated by prejudicial attitudes and beliefs. Stigma promotes discrimination among individuals at risk for experiencing or in recovery from addiction, as well as individuals associated with them. Addicted people and people in recovery are ostracized, discriminated against, and deprived of basic human rights. And individuals who are stigmatized often internalize inappropriate attitudes and practices, making them part of their self-identity. So what we'll get to in a second is talking about like the different faces of stigmas within, like internalized stigmas of people who do experience substance abuse or substance use disorders, and as well as how the public perceives addiction, as well as healthcare providers, and how these kind of work in a cycle to pretty much serve as like a barrier for people to seek treatment, just because of like the worries of being judged, or feel like a substance use disorder is just like a flaw of character instead of a brain disease, basically. So like many social phenomena, addiction-related stigmas develop and are sustained for a wide variety of reasons. Some of the reasons why stigmas are sustained are conscious and purposeful. Some are unconscious and stem from a lack of understanding. Some are personal, and some are social and institutional. So there needs to be a wider recognition of the susceptibility to the brain changes in addiction that are substantially influenced by factors outside of an individual's control, such as genetics or the environment in which one is born and raised in, and that medical care is often necessary to facilitate recovery. And a lot of times, individuals that do develop substance use disorders have been subject to either really traumatic events in adulthood or traumatic experiences as a child that lead to maladaptive, unhealthy coping.
Yeah, and a couple examples, being a person in long-term that I've personally faced and I've talked with others that have faced, you know, people might use these stigmas subconsciously, not mean to make the individual feel these different ways, but I definitely have experienced people that once they found out, especially when I was in active addiction, but even after I got sober, they would maintain distance themselves from me and not want to be around me and not want their families around me, to keep their self safe, and even I've had circumstances where people have definitely down, I think, to make themselves feel superior, not that bad. And, like I said, not all of this is just, a lot of it has to do with societal pressures and just subconscious what you feel. Issues like this, these are definitely ways that comes out.
So here are the different types of stigma. So societal public stigma is basically the public at large and just the overlying generalization of what people believe substance use disorders are, how they are established and whatnot. So, and that also involves recovery communities, relatives, and friends. So people with alcohol use disorder who perceive a high degree of public stigma toward those with their condition were about half as likely to seek help as those perceiving a low degree of stigma. So this public stigma, in turn, kind of goes into the structural stigma and feeds into that, because the less likely that people are to see or to empathize with people with substance use disorders, the less likely they are going to contribute to funding and stuff for treatment programs that might help individuals with substance use disorders. And then also with the structural stigma, that includes the treatment guidelines, correctional policies, funding decisions, healthcare, behavioral health providers, and correctional workers. So even healthcare providers can sometimes stigmatize individuals with substance use disorders. Bias among medical professionals and mental health service providers can reduce the likelihood that individuals with substance use disorders will be offered or receive appropriate treatment or be referred for specialty care. So if somebody is just seen as, a result of just a substance use disorder, or seen as an alcoholic, or, just pretty much labeling that person as that's all they are, and you pretty much wipe away any positive traits that person may have. And so when healthcare providers, use some of these negative terms, it helps that individual internalize some of those things and kind of creates a lack of hope overall. And then self-stigma is the individuals who experience or have these substance use disorders themselves and have internalized these negative stigmas from the public or family members, treatment providers, and then, like I said, ultimately lead to a lack of hope. So, and these self-stigmas that are internalized decrease self-esteem, self-worth, reduce their hope for recovery, affects their social relationships, and negatively contributes to their substance misuse.
Yeah, and a lot of times, it's hard to yourself as someone that is, it's hard to see someone as I'm an alcoholic or I'm an addict, and that is a lot of times what prevents someone from getting the help they need, is having that realization and admitting to even oneself that this is something that I'm struggling with. So the the more easily accessible that ideology is for people to come to terms with, and for, the society at large, that people like that, the easier people can deal with the self-stigma. And as an example, and moving forward to the effects of stigma, stigma erodes the confidence that substance-related disorders are valid and treatable health conditions. Again, this is going over all of those three types of stigmas we just talked about. It leads people to avoid socializing, employing, working with, renting to, or living near persons who have related substance-related problems or history. I'm in this Facebook group for this one part of town, and there's this restaurant coming to town, and someone commented on that, oh great, next to that place with all those drug addicts. Well, the place they're talking about is halfway house. So it's like, and that's just how this person that's really lucky, they haven't had to deal with this personally, that's how they see someone that goes to a halfway house. And so someone like myself that's in recovery, I see that, and that is a substance use issue and hasn't gone to get help yet. They see that, and it further prevents them from going to get help. Stigma deters the public from wanting to pay for treatment, reducing access to resources, opportunities for treatment, and so on. I mean, if you look at over the past decades and how the public has talked about people with drug addictions and criminals and people like that, and how we have come pretty far, but still there's a lot longer for us to go, and coming to terms with this is something that really anyone can struggle with. And when we reduce this stigma, it allows more funding and more availability for people to get the help that they need. Stigma prevents people from seeking treatment because of the fear that they will not be treated with respect or dignity within the treatment society, the system. Like I said before, when an individual suffers with this idea that I have a substance and I need help for it, but because of that stigma and because of the thought that how am I going to get a job if I go to someone that just gets out of treatment, am I going to go to a job interview? What do I tell them, where I was for the last 30 days, or why haven't I been working for the last 3 months because I've been these things are all barriers that prevent someone from getting the help they need. Luckily, again, being a person, I've people that are really understanding and they don't present this stigma. And when I say people, individuals, employers, different people in society have not met me with this stigma, but I've also had experiences where they have. And, some people, they get a job and they've worked there for years and no one at that job knows, and they're in recovery, that people are going to judge them and look. And it's one of the largest barriers that getting the help that they need.
So, addiction-related stigma is damaging. However, it can provide an opportunity for the recovery and treatment community leaders and activists and decision policymakers to come together, speak out, and enact change. So here are just like a couple of the steps that we're going to talk about a little bit more in the upcoming slides. So learn more, speak out, things like this, holding like this webinar and just like making this a conversation of topic to have, whether you're in recovery yourself or, if you have struggled with addiction in your life, this is something that I think is really important to understand. to help individuals who are thinking about seeking treatment or, trying to lead into that direction, knowing that they might need some help and whatnot. Just help them keep hope alive and not feel that they're going to be, pointed at and labeled as like, once an alcoholic, always an alcoholic or something, and just kind of like demeaning them to, as that's all that they are. So, and also just keep hope alive, treat people with dignity, and think about the whole person, like what happened to this person or what other factors played to lead them to this type of addiction. There's a lot of things to think about, and it's not just like somebody wakes up one day and says, you know what, I think I'm going to be addicted to alcohol. It never works like that. So really important to also educate yourself, speak out, and empower others. So here are a couple prevention strategies specifically for treatment programs.
So I know my microphone is out, so I'm going to try and stay closer to my camera. So number one, demystifying treatment, right? I remember before I even really knew what rehab was, and I knew I needed to get help, I knew I needed to stop using, but the idea that I had of treatment was what I've seen in movies or reality TV shows, I guess. And it was like this big scary thing where I was going to be locked in this house with a bunch of strangers. They were going to grill me about all the things I'd done wrong. And it was a really scary thought, and that in its treatment for me. And so I think we as an industry, a lot of work to demystify what treatment really is. But it's not this big scary thing, and it's not this place where you're locked away and you have no connection with the outside world. We've grown a lot as far as the treatment industry goes, and it's really, to some people, it's a getaway. It's being able to focus on yourself, your body in a way that you need. Number two, demystifying recovery. Again, I had no idea what recovery really meant and what 12-step meetings were or recovery or any of this stuff. The only thing I had about people in recovery was, again, what I see in a bunch of old people sitting around drinking coffee and smoking cigarettes. Very appealing to me, 2-year-old. And that's not what recovery is. Recovery is in many shapes and forms nowadays. You can recover in a number of different ways, and it's not this matter of this is the only way to get sober. Recovery to me is a life of freedom and a life not bound by drugs and alcohol. There are a lot of ways that you get to that point. And number three, I'm so sorry. Humanize recovery. These are just people that have something going on in their life. Not everyone in recovery is a criminal in jail or has done something wrong in their lives, and that's, again, part of this stigma. Have an SUD or, that's just not the reality, and that's not, what recovery is. And so taking that humanity aspect to it, I think helps not only the individual want to seek treatment and want to be in recovery, but also it helps the general public that. And number four, demystify relapse. Unfortunately, relapse is part of the process sometimes. Not all the times, but sometimes it is. And this relapse word has gotten such a bad stigma against it that relapse, your life is over and you have to start back from day one and you've lost all this progress. And that comes from the individual, and that also comes from friends as well as society. And that's not necessarily reality. Some people do have a lapse, but that absolutely does not mean that they lost all the work that they've done up until that point. And it doesn't mean that they have to start all over. You know, sometimes it's just a little bump in the road and you keep on going. And a lot of times that makes your recovery even learn from our mistakes. Number 5, celebrating and promoting success. The reason people have such big celebrations, and if you know anyone in recovery or have worked with anyone in recovery, get 3 months, 6 months, 5 years, 2 days, that's a really, really big deal, and it should be treated as a really big deal because it takes a lot for people to get to those points in their life. So continuing to celebrate and promote their success, even, speaking a little, sometimes someone may not be completely abstinent or completely, on the path that they want to be, but sometimes their life is living better than it was a year ago or 2 years ago. And sometimes that's just part of the journey. But being able to see people and how they are truly doing better than they were, or they're living a healthy life, or they're living a happy life, is something to be celebrated.
Okay, and so now we're going to kind of dive into the part of how we start to look at our own biases that we might hold. So even if you feel like, well, I've worked in addiction treatment for a while now, like I know how to speak to individuals in treatment, the right way, the most respectful way and stuff. But sometimes, like, we need to kind of do like a little bit of self-reflection and just check and see maybe we are kind of still holding some of those biases without even meaning to. So even the most well-meaning person can say the wrong thing, have inaccurate assumptions, and believe things that cause others to be stigmatized because of their addiction. Without even realizing it, we may have beliefs, attitudes, assumptions, or thoughts, or use words that contribute to the stigmatization of others. The following questions can help to examine your own potential for stigmatizing others.
Do I stigmatize others? So what are personal beliefs about why people become addicted? Do I secretly believe that addicted people are weak or sinful? If you are in recovery, do you believe that you are superior to others who are still struggling with addiction? These are all real, valid thoughts that very well-meaning and well-intentioned people think subconsciously because of the stigma that's been ingrained. I've gone over this already, but people do have this stigma that people that are in addiction are bad people, and that's just not the reality. So that's something on an individual basis that we should look at and just see, do I think this sometimes? And me being a person in recovery, do I believe that I'm superior to anyone because I got sober? And I try not to, because I remember that I was that person at one time, and I wouldn't want someone that has found recovery thought of me that way. Do you accept certain types of addictions more than others? That addiction to illicit drugs is different or worse than addiction to legal drugs? Or do you believe that it's easier to recover from addictions than others? As a society, in my opinion, it seems more acceptable to be an alcoholic and struggling with drinking than it does to be a drug addict. Alcohol is legal. There's a lot more support for alcoholics and people that have a drinking problem. I mean, I can't tell you how many people I've heard that say, oh, yeah, I'm a heavy drinker, and yeah, I get into trouble when I drink, and I drink too much, but it's no big deal, and I'm taking care of it, or I'll just slow down on the weekends or whatever. But if someone were to say that about using heroin, oh, I kind of have a heroin problem, but it's real. There's a big difference there when we hear those things. The reality is they're both very, severe use disorders. Do you believe that some people are beyond help? That some people are doomed to a life of addiction because they're high risk factors? That someone will get better? When you look at someone that's on the corner of the street and they clearly look like they've been through, look at that person and think, and like they're beyond help and they got it rough and sad for that person. And then do you look at someone that together and is their addiction and as a 9 to 5 and think, oh yeah, if they just go to rehab, they'll be able to get fixed. When in the reality is both these people have a substance use. These people, if they got the fair amount of treatment, opportunity. Do you believe that recovery must look a certain way? Are you quick to judge the behaviors of others and interpret all their behaviors through the lens of recovery? If you're in recovery, do you judge other people's recovery based on your path to recovery? If you're in AA, do you judge people that go to NA? If you are someone that got sober without a 12-step program, do you judge people that got sober with a 12-step program? If you had a prescription pill addiction and you haven't taken a prescription pill in 10 years, but now you drink on the weekend. And in the reality, these things are very prevalent within me as someone that got sober through the program for a long time in early recovery. I couldn't wrap my mind around my own person. That's what worked for me. That's what helped save my life. I just didn't believe any other options would help because of that's not the reality. Now, working in the industry and more open-minded to hearing people's stories, many pathways of recovery, there are many people that have gotten sober differently than me. That's 100% okay, and that's something now I support. Whatever way they want to try and get sober, because I am not the end-all be-all. I am not the only. And, again, these are hard questions to ask yourself and be like, do I judge people? No one wants to do that work. No one wants to admit that we stigmatize others, especially working in this field when part of our job is to help end this. But the reality is we're humans. Sometimes emotions in our subconsciousness gets the best of us. So an important step to ending this stigma is looking within ourselves and seeing, what do I think about others in different situations and how can I change?
Okay, so on this next slide, so this kind of shows the importance of language here. So this research study was done by the Recovery Research Institute, and they asked people how they felt about individuals actively using drug and alcohol use disorders. And so in one part, they referred to the individual as a substance abuser, and the other one as a person having a substance use disorder. So, and they found that the substance abuser was less likely to benefit from treatment, more likely to benefit from punishment, more likely to be socially threatening, more likely to be blamed for their substance-related difficulties, and less likely that their problem was the result of an innate dysfunction over which they had no control. and they were more able to control their substance use without help. So this just basically highlights the evidence and shows that labeling somebody as like a substance abuser, an alcoholic, or a junkie can result in like a decline of sympathy from the public. So basically, pretty much looking at it as in that substance use problem is because of the individual themselves and not other biological factors or, like a history of trauma or anything else that actually does contribute to these disorders. And so the decline in public sympathy results in less funding to substance use treatments focused on, less funding to just substance use treatments in general. Okay. See, this next slide got a little messed up, but it's fine. So this is a part where I had just how the language matters in here. And we hope whenever we, like I had said earlier, whenever we label somebody and say this person is an illness, we take away their hope. When you say this person is cancer or this person is an alcoholic, that's, you wouldn't do like the former. Nobody is, presented as like somebody like having cancer and like that's all they are. So like whenever you say like an alcoholic or somebody who's like heavily addicted or something like that, it just says that, that's all that they are, and basically takes the hope away. But whenever you say use person first centered language, you just show that, this person is living with this disorder, this person is living with cancer, and, gives hope to that person, for recovery and living like a happy, sustainable, healthy life.
So language matters. Language matters. Don't define. People are more than their health problems, and this all goes along with what Alyssa. Addiction does not describe what a person is. Addiction describes what a person. A person's addiction represents only a part of the person's life. Defining people exclusively by their addiction diminishes their wholeness of their lives. Don't say the addict, addicted, or the alcoholic. Say more people with the addiction, people with the addictive disorder, or people with alcoholism. Putting that people first makes a huge difference. Talking about people gives it more humanity and more sympathy, and don't sensationalize addiction. Although the consequences of addiction are often dramatic, describing addiction diminishes the fact that addiction is a treatable disease. Don't say suffers from, afflicted with, victims of, the source of addiction. Rather say he has a substance. She is with addiction or addicted people. That's why it used to be substance abuse, drug abuser. Now it's a user. Use drugs. And don't generalize. Don't generalize about addicted people. Not every person that suffers from something. There are varied as the general population. There is no addictive personality. It's not just because you start using your Xanax, all of a sudden you have this addictive personality. Just uses heroin. Every person is different. Every user is different. Every person that doesn't have a substance use disorder, what makes this any different? There is as much biological, psychological sociological variety among addicted people as there is among the general population. Don't generalize.
Okay, so here are a couple of examples how, especially like treatment providers, anybody that works in like the substance use treatment or healthcare industry, can change the language that's used like within treatment when working with patients. And so some of these, terms and stuff like might be used by the patients, and that's okay, like that's their language to use, even though we do want to kind of at least highlight the fact that these terms or these labels can be, negatively impact them and, their the community and their peers in recovery. So even if somebody says, well, I'm an alcoholic, which is very common to hear, if that is the label and the terms that they want to use, like, let's leave that up to them to decide. But as treatment providers and healthcare providers, I think it's important to use some of these terms that are more appropriate now and, removing like those negative connotations from them. And it's just gonna overall, like I said earlier, bring more hope into treatment and show that it's not, substance use disorders are not just like a flaw in moral character, or just a decision that, they have every say into like, ending that substance use disorder. It takes a lot of, treatment, community support, family support, and other things to help individuals get past their addiction, and sometimes medications and as well. Like there's a lot more that goes into it. It's not just simply a choice to stop. So for example, former addict. So instead of saying a former addict, you can say person in long-term recovery, person in recovery, person who discontinued use. And then as far as like, doing drug tests and things like with the results that like nurses and stuff might get back at a hospital or in a treatment facility, instead of saying it was a clean or a dirty urinalysis, you can say or show that the urinalysis proved that the individual is not actively using or actively using. And some other terms that they like to say is healthy or unhealthy with those two, and kind of also go into like different situations and stuff wherever you're communicating in healthcare. And then also drug seeking is one that I've heard often and throughout my different, like my mental health career. They prefer to say relief seeking, because drug seeking is just, it has that negative connotation with it. And then addict, so instead of addict, say person with a substance use disorder or opioid use disorder or alcohol use disorder. And then relapse, instead of saying relapse, to say the recurrence of use. So these are just kind of like the beginning of like changing the language. I hear so many other derogatory terms other than these on a daily basis, which I won't even get into, and I'm sure that all of us can think of an example of referring to somebody who was assumed to have like a substance use disorder. There's better ways of saying this that, gives hope to that person and lets them know that like this, them developing a substance use disorder is not, not something that's just wrong with them from birth. It's just something that happened over time, from like a traumatic experience, from coping with that, or, coping with a really stressful job, or, coping in a pandemic that's just been so unpredictable and stressful. Like so many people, especially now, are, experiencing severe mental health issues. And I'm pretty sure that most of us can say we've seen that within the workplace. So there's a lot going on, and we just need to, be quick to not judge so much and just understand that there's a lot of things that play into, a substance use disorder or an alcohol use disorder, etc. And that pretty much wraps it up from us, and we will go ahead and go into our Q&As here.
All right, so we do have a couple here. The first question I see is, it says, I've had people even in professional settings use the term, quote, this person fell off the wagon, end quote, and I try my best to address that when I hear it if the opportunity is appropriate. It's such an antiquated term and shows a lack of understanding of the disease of SUD. That's maybe more of a comment.
I mean, yeah, how, like, wagon again, or whatever, and it's just, it's outdated and it has a negative connotation. And again, instead of just meeting that with had a lapse, or he had a slip, or he had a bump in the road, that's my favorite one. Not this earth-shattering thing necessarily. It can be a little worse than others, but for the most part, they are. It's just a bump in the road, and it's what do we do to off and continue on this journey.
We have, do I stigmatize others slide? And then it says, I have seen many substance abuse counselors who are benefited from, are so tied to AA that clients who are not successful through AA are, quote, not doing the work, end quote. I have heard a lot that, quote, it works if you work it, end quote. I think this can add to feelings of shame and guilt.
Yeah, I mean, again, I'll speak on this one. Absolutely. No, and it's hard because a lot of and certain things even used based out of the programs, and so I get it. I understand why people say those things, but it's just not the reality anymore. There are people that have successfully recovered ways, and it does 100% add because they're not doing it exactly how done. Again, that's just not the reality anymore. We can get sober other ways, and should be of people trying to get sober in other ways. Now, you can give suggestions, and I always say, personally, this is how I got to the point where I have in my recovery, but I would love to hear what your ideas are of where that might differ. We can still help you attain in a way that's comfortable to you.
Yeah, and then I like these questions a lot because it does just show how normal it is to hear these stigmatizing statements, even from the doctors that we work with or the therapist, and it shows how strong societal stigmatizing happens. That's why it's so important to kind of look at those questions and also bring one thing that I'm hoping that we can work on at Lakeview is doing a whole training on how to teach staff to remove some of these negative phrases and terms and stuff especially when speaking to patients directly, because it's just sometimes you'll hear those phrases and you're just oh, that just doesn't sound good. So.
And then we have a comment. It looks like someone piggybacked on what the last question was. Once an addict, always an addict, question mark. No matter how long you have been sober, addiction is a chronic disease. Then we have, on the addiction-related slide, you mentioned the stigma of the, quote, once an alcoholic, always an alcoholic, end quote. Doesn't AA get participants to consistently say, name, and I am an alcoholic. Can you speak to that? As a clinician, I have never liked that.
In
Yeah.
that sense,
Yeah.
yeah,
Sorry, Lexi.
so you're okay. I think, and that's why there are multiple paths. Some people are completely okay with that, and that helps them in their, and some people that there's a great about the world we live in today is there are multiple ways to get sober and different ways to help people in their own way that they need.
Yeah, I think that is a big theme in AA, to say like, my name is so and so and I am an alcoholic. And, you know, treatments aren't like a one size fit all kind of thing. And I think that the patient or the individual that is seeking help for the substance use disorder should be the one of the biggest what's the word? They should be the one that decides like how they want to go about the treatment and what's going to be the best fit for them. So if going to AA and, speaking with peers and, using like labels like that, it's going to be what helps it resonate in your mind and help you get through like treatment and everything, or, your recovery. I think that's totally fine. But the difference is, whenever we are treatment providers and therapists and case managers and stuff working within like a treatment facility, I think it's important to avoid using labels like that and almost not necessarily discourage it, but also just like, speak about it. Like one of the slides said, to just shed light on how that can seem demeaning and like diminishing like hope and everything that person is outside of being an alcoholic.
Okay, next question we have, how would you suggest that we as healthcare providers get this important message out to the general community?
So that's something I've been working on myself. That was the big question. So this is the first part of this whole like anti-stigma campaign that I've been working on here. So I had to talk to the marketing team and I said, how can we share this so that, not just Lakeview starts to implement this, but other healthcare and treatment facilities? How do you start that conversation? And from the research that I've done, they say, to use those like 5 points that are described, so demystify treatment, stuff like that, but to kind of pinpoint it at a more macro level. That's why we've done this like Bridges event to talk to, other treatment facilities and everything. But also, I think treatment facilities can start, maybe like a committee and say, okay, how can we tackle this problem? Because, just about anybody in your facility, doesn't matter what level they are, they've noticed this from, their patients and their lived experiences, or just hearing it from a coworker, like it's a big discussion that I think needs to happen within a lot of treatment facilities. And I think it really just takes that one person, whether they're at, the CEO level or they're just a patient advocate like myself. I think it's important to, bring awareness to this topic and to start making a difference in how we use that language, because substance use disorder treatment, it's holistic, it's a little complicated at times, and because there are so many different fits for patients and everything. But regardless, I think it's important to keep that hope alive and remove like any of these negative labels and phrases for sure.
Okay, we got a few more here. Hello, I work at a hospital and find that many providers, staff use stigmatizing language. I hear things like, quote, drug seeking, end quote, all the time, and I am unsure how to address this and advocate for patients who are labeled as, quote, drug seeking, end quote.
Yeah. So kind of like I just said with that last question, I think talking to your supervisor or somebody that, is always open to listen to your opinions, and just kind of take what you say into account and values that opinion. Somebody that could listen to you to help brainstorm and say, okay, how can we get together? Who else in the company feels like this? And not necessarily to, start pointing fingers or, punishing people for using these, stigmatizing language. I think it's all new research, and it's proven to show that it is one of the largest barriers preventing people from seeking treatment. And so it does need to be discussed. I think it just comes from a lack of knowledge and not knowing that these, negative labels are contributing to the larger problem, and, keeping this cycle of public structural self-stigma, going. So yeah, just talking to a supervisor, talking to coworkers, and seeing who might be on the same page.
Negative association language has been my experience as a clinician in treatment settings. Has it changed much in recent years? Is reducing stigma part of how these settings are currently operating?
So it's fairly new. And I think it's important because there is a lot more research is coming out now of how changing the labels and everything is much more effective when working with patients. It has better treatment outcomes and promotes better recovery and reduces chance of relapse and everything. So that's why I was trying to get the ball rolling with this and just go ahead and try to make it the new normal. I don't think it's something that has been used. I tried looking into other treatment centers and stuff who might have been starting to help reduce that stigmatizing language and stuff like that, but there's not many that have started yet. But I think we're kind of entering a new era per se in treatment that I think is going to be really helpful, and just especially for our patients, and helping people seek treatment that might have been scared to because of the fear of stigmas.
We have a comment here that says, just letting people know about the Stability Network, and the website is listed as www.thestabilitynetwork.org, which is a volunteer group of professionals in recovery who speak openly and publicly about our addiction/mental health conditions for the purpose of reducing stigma and increasing funding for treatment services.
Sorry, what was the question part in there?
It wasn't. It was just a general statement that there is this organization that does that. So the stability, let me go back to it. The stabilitynetwork.org is the website.
Oh, nice.
Thank you, Susan.
Yeah, I need to look into that.
And then it looks like we have a couple more. Let me see. I think I read that one. Sorry, let me go back to something else here so we're not repeating. We have someone who says that they agree. Let me go back to this. Sorry, there's comments and people agreeing, so I'm trying to get to the top of the statement so it all makes sense. Okay. So here it looks like a question. Is it possible to work with someone that wants to cut down on his drinking and is willing to do this little by little? This seems to be the best way to, I'm sure, I think there's a word missing, best way to address this person's needs because he is willing to be educated about his alcohol abuse. And then in parentheses, beer only.
Go ahead, Lexi.
I was just going to say, again, great thing about recovery treatment is it is very individualized. it depends what's going to be best for this individual. Is it a sustainable and safe way to live, cutting back a bit? If it is, then and if that's all he's willing to do at this point in time, then that is better than nothing and ignoring the problem. Also, sometimes just meeting someone in the doorway to maybe getting someone to or getting someone to talk about becoming abstinent. So I say it's always great to meet someone where they're at and just see where it goes from there. And that's my personal
Okay, then it looks like we have a comment, and then I think we have covered everything here, but I don't want to skip anything. So I have someone that wrote, once an alcoholic, always an alcoholic is no longer used. I am a recovering alcoholic. In AA meetings, identification as an alcoholic lets the newcomer know that they are in the right place. And then someone wrote on top of that they agree with this, respect the house you are in.
Yeah, I agree with that. Like I said, in AA and NA meetings, it's going to look a little bit different, especially within this like whole subject of changing the language and stuff. But I know in AA it serves as a purpose to say, I agree that I am powerless over this addiction and that I simply cannot, change it alone. So that's like a powerful statement for somebody, to say. But I guess in regards to just like joking or just like bringing it up on a regular basis of just being like, no, I'm an alcoholic, I think it's a little bit different. But in the AA and NA meetings, I totally understand why those terms would be used. What do you think, Lexi?
Yeah, I agree 100%. They said with what you're saying, depends where you're at and what you're comfortable with. Personally, that's something that I needed to find myself that I couldn't drink. My life always ended in shambles and I would try. So for me, it worked. For other people, it doesn't. And for other people, it's more negative than it is positive. And that's 100% okay too. The world we live in today, we have options and we get to support people in options that's what works for them.
Yeah, and I think it's really based on the individual themselves too. It's like if you want to, say that, especially in an AA meeting setting, like that's up to you to say. But I think the problem really starts is whenever everybody else starts to point and label you as the alcoholic. Like that's for you to come to terms with, not for anybody else to sit there and say you're an alcoholic,
Okay, that's all I see. So we thank you, Alyssa and Lexi, for doing this presentation for us today. And thank you to all of the attendees. And this concludes our presentation.